Good morning, and I want to welcome you to the grand opening for the Center for Medical Education. We've been waiting a long time to say those words, and we can't just express how excited we are to celebrate this with you today. I'm Kevin Flood, President and CEO of the LSU Health Shreveport Foundation. You know, this celebration is a culmination of years of hard work and dedication by so many people, many of which are here with us today. You all had a part in this. We'd first like to thank several individuals and groups that were key in securing public funding for this transformational project. As I recognize these groups, please wave or stand for the audience to recognize you. Of course, the person who's led this from the very beginning, he sees the value in North Louisiana and what LSU Health Shreveport means to not just this community, but to the state, and that's Governor John Bell Edwards. This group of people led the charge in Baton Rouge to make sure that we had the proper funding that we needed. Members of the Louisiana House of Representatives and Senate. Locally, members of the Caddo Parish Commission and our parish administrator are with us today. If y'all would raise your hand. Thank y'all. And then members of the City of Shreveport City Council and our mayor. We were lucky enough to have federal funds as part of this project with our Center for Emerging Viral Threats. And today we have several members of our congressional delegation offices represented here. We have representatives from the offices of Speaker Mike Johnson, Senator Cassidy, and Senator Kennedy. If y'all would just raise your hands here somewhere. Thank you. And also from our higher ed groups, the Louisiana Board of Regents, that we have right down here in the front row. Thank y'all. And most importantly, the folks that work hard every day for LSU, it's our LSU Board of Supervisors. Thank y'all. Thank you to all these groups for believing in us from day one to make this happen. Also, there were over 400 community individuals that donated to this building, which is absolutely amazing. I've had the pleasure of working with many of you all individually, and it's been a great honor to do that. So thank you for being here. As you probably can imagine, we sold bricks for this building. And if you haven't bought one yet, see me afterwards. But they're actually behind the group in front of the dining pavilion. And when I first was looking over the list of the different names on the bricks, right? Typically it's going to be, Kevin Flood, class of whatever, in honor of, in memory of. There was one brick, though, that caught my attention. And it simply said, "You matter." And Katie from our office can tell you, when I first saw that, I said, "What is this? Why is someone just putting 'You matter' on the brick?" And the more that I thought about it, it made sense. And I think it makes sense more importantly for this audience today. Because whether you bought a brick or named a classroom or helped secure public funding for this project, you matter. And even if you didn't, because you're here today, you understand the importance that LSU Health Shreveport means to this community and to the health and well-being of this community. And so if you get a chance, when you're done with the tours and everything, walk over there and see that brick that says "You matter." Because you all here in this audience today, you matter to LSU Health Shreveport, and we thank you. Isn't this a beautiful building? We want to thank the architectural firms of Coleman Partners and Perkins and Will, who came together to create this work of art. Thank you to them and our general contractor, Lemoyne Company, for delivering this masterpiece to us. Now, let's get this thing started off. There's no better way to kick it off by hearing from one of our students. Please welcome to the podium Tyler Tran, Student Executive Council President.
Good morning. My name is Tyler Tran. I am the president of the Executive Council and a third-year medical student here. It is my honor to convey on behalf of my fellow students in our 3 professional schools the immense excitement about the opening of the Center for Medical Education. While we as students recognize we are already receiving an extraordinary education thanks to the faculty, staff, and leadership, we are counting the days until we can attend classes in the light-filled, inspiring facility. Did I mention we can't wait to be in a building with so much natural light? The opportunity to clear our minds through the fitness zone, one of the several student lounges, meditation rooms, outdoor spaces, before returning to our studies and or research projects is something we are looking forward to as we recognize the importance of physical and mental wellness plays in our success as students. To each of you who have invested in our future as students, I offer a huge thanks on behalf of myself and all the students of LSU Health Shreveport. Know that we will do our best to make you proud and to continue the legacy of LSU Health Shreveport graduates successfully serving and competing at the highest levels. It is now my honor to introduce Chancellor Dr. David Guzick, who set an example of a successful career as a clinician, scientist, and administrator. Thank you for your leadership and for challenging us to always aim high. Please join me in welcoming Chancellor David Guzick to the stage.
Thank you, Tran, and welcome everyone on this very special occasion as we unveil this truly magnificent Center for Medical Education. As someone who has been at LSU Health Shreveport for just short of a year, I realize that I'm very fortunate to have so many others who came before me who had the vision and the tenacity to bring this project to fruition. So on behalf of our 1,700 students, residents, and fellows, 2,600 faculty and staff, and really the citizens of North Louisiana, I offer our deepest gratitude to all of you who worked so hard to bring this dream of a Center for Medical Education to reality. As you heard from Tyler, since coming to US Health, LSU Health Shreveport, my mantra has been to aim high. And this is entirely in concert with President Tate's vision for LSU as a whole. And in opening this Center for Medical Education, we can indeed aim higher in delivering a modern education program to our students who will find the cures of the future and who will improve the health and improve the quality of life for so many patients in the years and the decades ahead. And because the building also has research space, highly specialized in nature, we can also aim higher in the impact of the scientific discoveries we make, in the amount of extramural dollars we can bring to LSU Health Shreveport, and to the economic development we can drive. So now, as we celebrate the vast opportunities that lie ahead, it's my honor to introduce a visionary leader, my boss, and the president of LSU System, Dr. William Tate IV.
Thank you. Today is a day of imagery and thankfulness. From an imagery point of view, I remember coming to Shreveport interviewing for this job, and I said something during my interview, and my hope is this image manifests. It was a simple statement that I wanted LSU to be a place where you can win the Heisman Trophy and a Nobel Prize. We got the Heisman Trophy. With respect to the Nobel Prize, I want you to imagine with me today that in this building, sometime in the future, there will be a clinician scientist prepared from Shreveport who will win the Nobel Prize. I say to you, Dr. Guzick, Dr. Kibble, you're not off the hook. Dr. Lewis, I see you. Faculty and staff here, it is my expectation that you will operate in such a fashion in this wonderful facility that that imagery will manifest. Thankfulness. You do not get to this point without leadership. Generally, on a capital project, it starts with the LSU Board of Supervisors. Thank you. And then it moves to the Board of Regents. Thank you. And then it manifests in an all-out fistfight called the legislature. And to get to this point, the Northern Louisiana delegation that represents this area had to fight competing interests around the state to get this appropriation. Thank you. Now, someone has to sign it. It's called the governor. Now, just a moment about this gentleman. In the annals of higher ed, which I try to keep up with, there are a number of governors who are associated with moving higher education forward. I, top of mind, think of Governor Alexander in Tennessee, Governor Hunt in North Carolina. This governor inherited a very difficult circumstance financially, and it would have been easy to turn away from higher education. But rather than turn away, in partnership with the wonderful members of our legislature, over the last 8 years, the investment in higher education has completely turned around. And I'm thankful to my legislative friends and colleagues. I'm thankful to you, Governor. I believe you, sir, will go down in the annals with those other men who invested in higher education over time, especially here in the American South. And I would like to say also, I'm very happy that you beat Navy. Because it was quite painful to watch you during our game against your lovely and wonderful alma mater. And while we have now evened the series 1-1, I hope that you take satisfaction in knowing that when I was there with Jaden Daniels, as he won that Heisman, I had my couplings from West Point on. Without further ado, the governor of the state of Louisiana, John Bill Edwards.
Good morning, everybody. Thank you. President Tate certainly said it, but LSU Heisman Trophy, Jaden Daniels on Saturday night, Center for Medical Education here in Shreveport on Monday morning. It really doesn't get better than that. And I absolutely. And I am a fanatic when it comes to LSU football, LSU athletics, whatever. I am as or more excited this morning than I was on Saturday night, because this is going to make a transformational difference for our state for generations to come. We don't get many opportunities, even in the best of times, to make the kinds of investments that you're looking at right here. And that's what this beautiful building represents. It is an investment. It's not just dollars. It's an investment in our young people. It's about increasing opportunity and prosperity, but doing so in a way that is going to lift up so many people around our state and for so many years to come, because we're going to educate and train and inspire young people here to go out and care for those who need it the most, to lift them up, to talk about preventative measures that they can take to maintain better health, and to diagnose disease and to treat those people. And that's what this is about. And I am just incredibly excited about it. And I applaud Chancellor Guzick's mantra of aiming high. He mentioned it today. That's what this is about. And look, I hate to even allude to it, but before I was governor, I was in the legislature for 2 terms. Early on, when we had that $2 billion budget deficit, I know there were people up here questioning the state's commitment to this medical school. And no matter how loud, no matter how often, we said we are fully committed 100%, not just to keeping a medical school in Shreveport, but growing and investing in that school. And I know that it was kind of hard for some people to believe that. I hope as you sit here now, you absolutely believe it. We are 100% committed to this medical school. We're committed to Shreveport. We're committed to North Louisiana. Look, the reason I'm as excited about this as I am about that Heisman is good health is essential to a quality life. And you can't have good health without healthcare professionals. And we want to inspire the very best in Louisiana to study in Louisiana, to stay in Louisiana, and to make that profound difference. That's what this building represents. I suspect this will be the last time that I'm in Shreveport as your governor. So I do want to say that I appreciate the opportunity that I have been given to serve in this capacity over the last 8 years. It has been challenging, but I have served with some wonderful, wonderful people, and the people of our state inspire me. And together we've been able to do some things that have been very positive for our state. We're talking about health care here. Today, more than 500,000 of our working poor brothers and sisters have health insurance who didn't have it when I became governor. I am very proud of that decision. The uninsured rate has fallen by more than half and lower than the national average. The state has saved money. Hospitals and others are better reimbursed. And unlike our neighboring states who haven't expanded Medicaid, we have not lost a single hospital in Louisiana. The COVID-19 pandemic was challenging, but I want to thank all of the professionals here and the students here at the time for stepping up. And absolutely, it was incredibly challenging, but to see all of the people here stepping up and pioneering ways to better care for people. There was so much good work that came out of Louisiana, and every time I would go to the White House or wherever I went, they were highlighting our efforts here, and so I thank you all for that work. Look, I'm gonna close by just thanking you again for the opportunity to be your governor, to letting you know that I am as excited and optimistic about our state as I have ever been. Together, right now, we don't have a $2 billion deficit. We've got $3.2 billion in the bank. We've got the lowest unemployment rate ever measured, the highest gross domestic product, the 10th fastest growing GDP in the country, the highest personal income, and we are supporting our critical priorities again. So obviously, capital construction, you see it. That's what we're celebrating today. But there's $465 million more in recurring revenue for higher education for operational expenditures today than there were the day I became governor as well. And I'm going to leave with this note. You cannot invest what you do not have. We did not have when I became governor. And we did not have because there were some decisions that had been made in the years prior to that turned out not to serve us very well. But working together on a bipartisan basis, we were able to turn that around. And that is why we're here celebrating today. And so I thank everybody. I thank the members of the legislature who are here, one of whom is your next speaker. And I can tell you that he was the member of the legislature who was on my 2-yard line for the last 8 years about investing here in Shreveport, in this medical school, and yes, in this particular building. So I want to thank him and ask you all to help me welcome to the stage Senator Greg Tarver.
Thank you very much, Governor. It was not an easy battle working with the legislature from South Louisiana to get money from North Louisiana. But I want to say that because of Governor John Bell Edwards, it was much easier because he worked with us. He was committed to North Louisiana. He wanted to do some things for Shreveport, and he wanted to see Shreveport Medical School stay here. And I want to thank him personally. I received a call years ago from a guy who probably is not here. I don't know if he's here today. He called me one night at 11 o'clock. He said, Greg, he said, we need some money for educational building at LSU Medical School. I said, how much money are you talking about? He said, 50, 60, or $70 million. I said, you got to be crazy. He said, we need it here to enlarge the student body and to bring the expertise here that we need for Shreveport, Louisiana, for us to grow and grow. His name was Dr. Ghali. He's the one who called me, not one time, but 50 times. He called me all the time and was concerned about the medical school. Then he turned me over to Marquis, and she worried the hell out of me. Thank you very much, Marquis. But seriously, it took all of us from North Louisiana. I see some of the senators here. I see Senator Mills here. I see some of the future senators who I'm going to be working with, Sam Jenkins, Senator-elect. I saw Senator Presley here somewhere, who I'm going to be on like Marquis was on me every day to get things done for LSU Med School. Let me say this to you. I've been here with LSU, and I tell this story all the time. Since the board of Confederate Hospital, I was on that board. I look young, but I'm not. But we worked together, the community. We worked together to get the name change to LSU Med School. It took a lot of people who are not here today, working with everyone, working black and white, Republicans and Democrats, to get something done so Shreveport can grow. This medical school is the biggest plum up in this area. We must keep working together to grow it, to become number one in this country, not in Louisiana, but in this country. Let's stick together. Let's work together. Let's not party divide us. Let's not color divide us. Let's all of us come together to make LSU Med School the greatest school in America. Thank you very much.
Thank you, Senator Tarver. That was fantastic. You know, a project like this requires private funding, and from the very beginning of this project, we had a partner in Ochsner and Ochsner LSU Health Shreveport that was unwavering in their support. And so at this time, I'd like to call forward Dr. Leo Swanee to share a few words from Ochsner. Dr. Swanee.
Thank you, Kevin. Thank you, Governor Edwards, Senator Tarver, President Tate, and all the distinguished guests and elected officials and contributors that made today possible. I also want to spend a special thank you to Dr. Guzick. We're fortunate to have you as a partner in North Louisiana. Together, we are improving health care in Louisiana while training the next generation of health care providers. This is a monumental day for our state, for LSU, for Ochsner, and the entire region. I must admit, this milestone is personal, and it fills me with overwhelming pride to be here today. Because you see, I grew up in Louisiana. I graduated from LSU School of Medicine in New Orleans. I completed my pulmonary critical care and lung transplant fellowship in a joint combined program between LSU and Ochsner. So I'm a product of an Ochsner-LSU partnership, and I'm a witness to the successes and the impact these two organizations can have when they work together. This project is also close to my heart because it furthers our mission of creating a healthier state for all of Louisiana's citizens. One major challenge to the health of our state and our nation is the physician workforce crisis, and it is a crisis. The AAMC has projected that up to 124,000 physician shortage by 2034. Just think about that. And we know that that's not homogeneous throughout the United States. We will feel that impact more in the South and more in Louisiana. In addition, the U.S. has the lowest number of physician graduates per population when compared to most European countries, Mexico, and Australia. This medical education building is essential for helping LSU Health Shreveport address the physician shortage in Louisiana and the United States. At Ochsner, we're also committed to academic excellence. This means partnering with exemplary institutions and changing lives for the better by training thousands of students each year in our facilities. Our partnership with LSU is an integral part of this promise. Coming full circle, I've also had the great experience of being part of the Ochsner LSU Health Shreveport partnership since its inception 5 years ago. I know the hard work, resilience, compassion, and commitment to excellence and commitment to our communities that makes this Ochsner LSU team special. The collaborative and collegial approach results in major accomplishments like access to higher quality care for our communities, growth in research, and excellence in medical education. These accomplishments make real and lasting differences because every success is connected to the people's lives in our communities. You see, this is much more than a building. It houses millions of stories yet to be told. Stories of achievement from students who have committed themselves to caring for others. Stories of camaraderie, friendship, and memories that will last a lifetime. Stories of hope for a patient with an illness whose cure is on the horizon. Stories of healing for countless of patients. And a story of transformation for our communities and our state as we build a healthier tomorrow together. Today we see a state-of-the-art building, but the stories waiting to unfold are proof that working together and our vision of a healthier state can come to fruition. My deepest gratitude to all of you that have made this new medical home for medical education possible, as you're making a difference every day. Thank you for the opportunity to speak here today on this momentous occasion. And without further ado, I'd like to introduce Corwin Harper, our Chief Executive Officer for the Ochsner LSU Health System.
I think I'm supposed to say "Go Tigers" before I get started. Would be appropriate because I'm a transplant from South Carolina, and my wife, Dr. Terry Harper, is also a transplant from Alabama. So somebody said, "Why Louisiana?" And I said, "Well, why not?" Somebody said, "Well, why Shreveport?" And I said, "Well, definitely, why not?" Because I want to talk about my why I accepted the job to come here November the 1st to be a part of this wonderful organization. First, it starts with the mission to heal, serve, lead, educate, and innovate, but the most compelling word that drew me here was the word discover. We have the opportunity to discover cures for illnesses for the citizens of the state of Louisiana, but more importantly for the world. The second thing is the vision. When I read the vision that we want to be a global, not just national, but a global academic leader, I said, I'm all in. Pete had to slow me down before I got in the car to drive up here. And that's Mr. Pete November, the CEO of Ochsner Health. And why is that important now? I want to say to all of the legislators, all the guests who've donated, all the leaders on this platform, well done, thy good and faithful servant. Because you made a series of choices to say, we want to come together to ensure that the health and well-being of the citizens of the great state of Louisiana, and also especially those who live along the I-20 corridor, we want to make it better and greater for those generations to come. Because we have a responsibility not just for today, but for the next 20, 30, 40, 50 years, and this building and this moment is the beginning of the future. So I challenge all of us to do our part to make humanity better so we can become the global academic leader to shape the future of healthcare, not just for this corner of the world, but for the entire world. So I thank you. My wife, Terry, and I are humbled to be here, and thank you for welcoming us into the family of LSU and Ochsner Health. Go Tigers.
Thank you, Corin, and welcome to Shreveport. All right. Bubba Raspberry needs no introduction. Many of you know him. His legacy of civic engagement and commitment to our community is already well established, and it is an honor for me to work with him on a daily basis on the foundation board. As the building reached the point where it was fully funded, Bubba knew we couldn't rest on our laurels. He knew that in order for it to reach its full potential, the building would need funding to support the programs within it. So it brings me great joy today to announce that Bubba Raspberry and his family have pledged the largest individual gift to this building. He is announcing that today we're announcing that the Bubba Raspberry family is donating $2.6 million to create an endowed lectureship series for this building. You know, we talk about that we're going to grow our own Nobel laureates. The first thing we have to do is bring them here so they can teach our students how to be Nobel laureates. And so that's what this lectureship series is going to do. It's going to bring the best doctors and scientists to Shreveport to share the latest medical knowledge and technology with our students, faculty, and U.S. community members. And it's all going to happen within our new 500-seat in the round auditorium that you'll see shortly on your tours. In gratitude for Bubba's generosity, the auditorium will be named in his honor. So please join me in thanking Bubba and welcoming him to the podium. Thank you, Bubba.
Well, thank you, friends. I and my family, following the footsteps of other individuals and families who supported the LSU Health Science Center in the past. It is meaningful and brings joy to my heart to see many of those individuals here and then many family members of those that have gone on. This has been a tradition. They have led us. I encourage you to follow them also. Our belief is that the Health Science Center certainly is the most significant or a most significant asset to our community and all of Northwest Louisiana. The care provided and the research that's done here is essential. It's my hope that others will consider following and supporting this noble enterprise. The risk and effort necessary for an elevated education must be honored. What you think about that? It's hard for an elevated level. The bar must be raised, and those that can must be encouraged. Life comes from what you give, in my opinion. I think you'll be measured ultimately by what you have given. Giving today by you and others and myself is for the future. Our entire community are thankful and appreciative of what all of you that are committed to the LSU Health Science Center do with your daily lives in service to others. I'm truly humbled to stand in your company.
Thank you again, Bubba. Okay, so now let's cut a ribbon and open up this building.
Okay. Everybody look here.
Everybody look here.